Binge drinking among young adults in Britain is continuing to fall, figures from the Office for National Statistics show. The proportion of this group binging at least once a week is now down from 29% in 2005 to 18% in 2013. It is thought that fewer adults are choosing to drink alcohol and also drinking less when they do. More than a fifth of UK adults now say they do not drink alcohol at all, a slight increase on 2005. Men drinking more than 8 units of alcohol on their heaviest drinking day in 1 week are considered to have binged. Whilst the average level of consumption has fallen, this may be in part due to the change in the ethnic makeup of the country, with many people abstaining from drinking altogether. Professor Sir Ian Gilmore, Alcohol Health Alliance. For women, binge drinking equates to drinking more than 6 units of alcohol in one day. 2 units of alcohol is roughly equivalent to 1 pint of normal strength lager, or 1 medium-sized, 175 ml, glass of wine. Teetotal trend. Binge drinking among all UK adults fell from 18% in 2005 to 15% in 2013, but it was in young adults aged 16 to 24 and 25 to 44 that the most noticeable falls were seen. Among these groups, binge drinking fell by 1/3 and frequent drinking by more than 2/3 since 2005. Increasing numbers of young adults aged 16 to 24 are now teetotal. In London, almost 1/3 of all adults said they did not drink alcohol, higher than any other region of Great Britain. But drinkers in the north of England and in Scotland were most likely to have binged. Around 1/3 of drinkers in these regions had binged, compared with less than 1/4 of those in other parts of Great Britain. It is estimated that alcohol misuse costs the NHS in England around £3.5 billion every year. Alcohol is still a major cause of ill health throughout the UK. Drinking too much can contribute to a number of serious health conditions, including cancer, liver disease, and heart disease. Long-term binge drinking is linked with an increased risk of strokes, cancer, and high blood pressure. Deaths from alcohol, however, are now at their lowest rate since 2000 in the UK. In Scotland, which had the highest alcohol-related death rate in 2013, the figure is significantly lower than 10 years ago, from 45 per 100,000 to 29 per 100,000. Professor Sir Ian Gilmore, chair of the Alcohol Health Alliance UK, said the results were encouraging, but there was absolutely no room for complacency. Whilst the average level of consumption has fallen, this may be in part due to the change in the ethnic makeup of the country, with many people abstaining from drinking altogether. Data on alcohol consumption is also unreliable. Many people underreport how much they drink. Culture change. He said alcohol remained the biggest single cause of death in the under-60s in the UK. The overall numbers of alcohol-related deaths may be down, but the numbers are still far higher than they were 20 years ago. Without effective action from government on pricing, marketing and availability, we are storing up major problems for the future. The Portman Group, the responsibility body for drinks producers in the UK, said, "These positive trends are part of a decade-long culture change around our improving relationship with alcohol in this country." But alcohol-related harms still remain, and some local areas suffer much more than others. The best way to support these communities is to get local businesses, police, local authorities, and health services working together to improve town centres, tackle harmful drinking, and make our high streets safer places to enjoy.